I used to run a team of analysts working on clinical trials. And I want to ask a question about partnerships with pharma companies. How about, choosing the right patients for clinical trials?
You hit on a really important area. The predictive analytics around, who is going to develop a condition that will require acute care services that is potentially preventable. I want to relate it, that context, I want to relate it to the one that you've just pointed me towards, which is, imagine a circumstance where we were able to leverage through partnerships or through internal efforts, precision medicine capabilities around biobanking, for example, that would permit us to understand whether there were cohorts of patients for whom we bore clinical human risk, but also financial risk, who had a particular genetic predisposition to actually not glean benefit from what is otherwise thought of as a standard of care pharmacologic intervention, a medication. And instead would benefit from an alternative that isn't necessarily as prominently displayed or perhaps even on the formulary. Well, first of all, we learn to update our formulary because we understand what real-world patients look like. But secondly, from the perspective of that patient and the cohort that they belong to, we can actually redirect them and their caregiver towards a prescription that will provide them with an intervention, and I'm just using this as a simple example, but an intervention that will actually permit them to glean the benefit of this and not end up in the emergency room and have people going, well, he's on all the right medications. I don't know why you're here. You must be really indiscreet with your diet, or you're a couch potato, or you're this or you're that. No, it turns out that the patient is just not somebody who's going to respond well to a medication like Plavix. They need something else. So I think integrating what I call the learning healthcare system angle on all of this into it, and doing so through powerful collaborations with those that can amplify our efforts, is an important part of using technology to drive value-based care performance excellence.